Now, the Health Secretary, Jeremy Hunt, has been told by officials to stop warning of dangers to patients from inadequate staffing of hospital accident and emergency departments at weekends. In a further leak of documents from inside the Department of Health to this programme, senior civil servants say that if he really wants to implement a 7-day service, he should stress the benefits rather than playing up risks that the public don't believe. Here's our health and social care correspondent, Victoria MacDonald.
It's called the weekend effect, a disputed statistical claim that patients admitted at the weekend are more likely to die than those taken into hospital during the week.
You are 15% more likely to die if you're admitted on a Sunday. If you have a stroke at the weekends, you're 20% more likely to die. That can't be acceptable. It's not acceptable to have mortality rates at the weekend that are 11 to 15%.
Statistics central to the Health Secretary's argument for a 7-day NHS in England and the reason given for changing the junior doctor's contract. But now Jeremy Hunt has been delivered what appears to be a rap over the knuckles by his own civil servants.
Channel 4 News and the Guardian newspaper have been leaked a series of documents from health officials in which they warn the government about their plans for a 7-day NHS. Now, in this latest leak, there is a clear message from those same civil servants to ministers. Stop talking about the weekend effect.
The document from the 7-day services governance group says,
the link to the weekend effect has not been helpful for 7-day service, as our insight tells us that patient safety is not top of mind for the public or the workforce.
It goes on to say that they need to talk about the benefits of 7-day services, including the provision of high-quality care, convenience and access. As we reported last night, civil servants have warned the government there is a risk of failure, that they may not meet the 2020 deadline because of lack of funds, staff, data and evidence. Now there are growing calls for an inquiry into the government's plans.
I think there needs to be an inquiry. Jeremy Hunt appears to deliberately flouted the advice of his officials, and there definitely needs to be a moratorium on both the introduction of a 7-day NHS and forcing the junior doctors to sign these new contracts.
In the same leaked document, civil servants also warn
the current financial context means we need to demonstrate that the 7-day service is achievable and realistic.
We have consistently warned this government that actually they needed to come out with a clear plan of how we were going to achieve 7-day services. And so what we have in effect is a lot of words or sound bites that says we will deliver 7-day services without a concrete plan of how that will be delivered, and the discussion that it will require more resources, whether that's staff or money.
A Department of Health spokesman said,
the benefits of a 7-day service for patients are wide-ranging. A safer NHS, more choice and better access to services. But we make absolutely no apology for prioritising patient safety.
But what civil servants also say in their advice to Mr Hunt is there is as yet no evidence one way or another that a 7-day service will achieve that very aim, making the NHS safer.